Hi, my name is Dr. Greg Ellis with Rehab to Perform. Today I want to talk to you about shin splints, what they are, when to know if you should get it checked out further, and how you can manage those symptoms to keep you performing at your best. Shin splints are a general term for lower leg pain that occurs along the shin bone, most often along the inner shin, and is associated with a group of symptoms that include pain with activity, tightness of the muscles in the lower leg, decreased strength in the lower leg, and irritation of muscle, tendon, and bone. This often occurs in active individuals who are either doing too much too quickly or are not effectively recovering between their training sessions. It is important to know when it is time to get your pain examined by a PT or orthopedic. I would recommend that you seek out care when you are having pain at rest or pain that is affecting your day-to-day activities and life between training or games. You should also get it checked out when pain is waking you at night, is not responding to medication, or has persisted for greater than 2 weeks without improvement. In these cases, it is really important that you get more serious pathologies ruled out, such as a stress fracture. To close, I want to show you 4 ways that you can manage your shin splints and keep you performing at your best. All right, for when you're dealing with those shin splints, you're gonna wanna start by foam rolling the calf. Just using that foam roll, you wanna roll back and forth on the inside part of the calf and the outside part of the calf. Then you're gonna wanna hit the front of that shin bone along some of those other muscles. So we're gonna flip over. I'll show you on my right side here. We're gonna hit right there along the outside of the shin, all the way down to the ankle. It should be sore, but not so bad that you're holding your breath. You can do this for 1 to 2 minutes. And we'll transition. For exercise number 2, we're gonna start conditioning those calf muscles. We're gonna go to a wall. You're gonna raise up into a calf raised position on one leg. And the goal here is just to hold this position for the allotted amount of time. There could be some soreness, but no pain. And we're simply holding that position. All right, for exercise number 3, now we're gonna start conditioning the front part of our shin bone, or the muscle that helps bring our toes up to our shin. So we're gonna grab a plate, a book, a wad of towels, something to raise that heel up at home, using the wall for support, just for balance, feet together. You're gonna raise those toes up off the ground. And you're gonna do that for the allotted amount of time. We're gonna see how many we can get before that muscle burn gets a little too much. Again, we're avoiding pain, but some discomfort, some soreness, and some burning in that muscle is definitely okay. For exercise number 4, we're gonna really start conditioning those calf muscles now with some impact and some jumping. What you're gonna do is you're gonna put these feet close together. These are gonna be our pogo hops for time. You're gonna start hopping in place, keeping that heel off the ground. Looks a little something like this. That's what it looks like from the front. Let me show you what it looks like from the side. Again, you're just trying to keep that heel off the ground the whole time. Our last group of exercises is just gonna be something to do after those exercises, a little bit of stretching. We're gonna start at the wall. We're gonna stretch out that calf muscle. So this is emphasizing the back of the leg. We're gonna drop down, keeping that heel flat, knee straight. We're gonna go until we feel a mild stretch, and we're gonna hold that position for the allotted amount of time. Once you've completed that stretch, we're then gonna work a little bit different on the ankle. It's gonna be called a knee to wall. You're gonna go about a fist width away from the wall, and we're gonna try to keep that heel as flat as possible on this front leg as we move that knee towards the wall. And you'll do that for the allotted sets and reps that we have there in the workout video. You'll be working here, just feeling maybe a little bit of a stretch further down in the ankle. If you are unable to perform these activities without excessive pain or pain that is sharper in nature, it may be time for you to get it checked out further by a professional.